Sure. All right, so why don't we do that? Start with some introductions. And so I'll start. I'm John Nowak. I'm the co-executive director for CHIP, the Community Health Improvement Plan. And I'll just call your name so we kind of keep things moving. Lori, you want to go next?
Hey, I'm Lori Fleming, co-executive director along with John.
Dr. Parker?
Hi, I'm Molly Parker. I'm with Jefferson Healthcare.
Alexa?
Hi, I'm Lexa Murphy. I'm a child psychologist in independent practice in Port Townsend.
Trish?
Trish Bethard, Superintendent, Brennan School District.
Susan?
Hi, I'm Susan O'Brien, nurse practitioner at the school-based clinics at Port Townsend and Chimicum and Quilcene now.
Tanya?
Hi, I'm Tanya Barnett. I'm a family resource navigator working through the YMCA.
Kate?
Hi, everyone. Kate Dean, Commissioner, Jefferson County. I'm sorry to say I have to leave early, but I get to go certify the Chimicum School District election, which is good news.
Denise?
Hi, Denise Banker. I am the coordinator for a coalition drug and alcohol prevention work in the Chimicum School District.
Jenny?
Hi, Jenny Vervink, a behavior interventionist, Kitsap Mental Health Services in Port Townsend School District, Salish Coast, and Blue Heron.
Jean? And we're so glad you could join today. Thank you.
Yeah. I'm Jean Scarborough. I'm the clinical director at Jumping Mouse Children's Center. So we do therapy with kids ages 2 to 12. And I will say I'm home with my kiddo today. So if I'm interrupted, I'm sorry, but she might be in and out.
And Jim?
Jim Novelli, Executive Director at Discovery Behavioral Healthcare, and I'm going to shut my picture because I'm trying to eat my lunch and you don't want to watch me eat. It's a horrible sight. So,
All right, thanks, Jim. All right, well, welcome everyone. We're glad you could all join us. I'm kind of trying to do some work in the off weeks to put together the thoughts that we discuss in our meetings. So I wanted you all to know that I put together kind of a straw man of what I felt like we talked about, but it's totally intended for discussion. It's not by any means anywhere near even a draft at this point. It's really just intended for discussion. So just wanted to make that clear before we started. All right, Lori, I think we could start with the slides.
John, I thought the notes were great. Thank you for doing that. That was great.
Lori did most of that.
Thank you, Lori, for the notes.
She is amazing. All right, so agenda for today. Next slide, yep. Welcome and introductions, a very quick check-in on data, and then what I'd like to do is show you, I tried to put, like I said, all of your comments into what we call a strategic framework. So I think we're going to look at that first, and then I'll come back and ask the question about the whether you had any questions about the data. Kate's got to leave early, and we at least wanted to give her an opportunity to look at this. So this is the tool that we use to develop the CHIP plan. It's called a strategic framework, and it basically uses goals, objectives, strategies, and activities to really line out what it is that we want to try to do. So I took the comments from the last meeting and tried to come up with what I thought might be reasonable, at least first guess at what that strategic framework might look like. And so the goal that I came up with is improve resources for adolescent behavioral health. And Lori and I both agreed that that needs some more tuning up in terms of, what are the measures related to that? Can we get a little more specific about what that means? What's the time frame that we might do that? But I just put that out there as kind of a placeholder. And then under objective 1, implement plans to reduce teen suicide in Jefferson County. And then I came up with some strategies underneath that. So sorry, Lori, it's a little tiny, but integrate enrichment youth activities with the schools that are effective for young families. Thanks, Lori. And then discern and activate an approach to connect more youth to mental health services in the schools. And I think there's a third strategy, right, Lori? Which is provide a forum for better integration of behavioral health services. And then I put some activities underneath each one of those. So the activities under the first, there were no activities under the first strategy. Under the second strategy, it's explore the Maryland Quality Mental Health Care Teaming Program and generate a better understanding about community resources. And then under goal C, it's use this group or form a new group that meets regularly to ensure collaboration between providers of youth behavioral health services. And then develop a method to communicate youth-related community activity efforts between providers. So that's, like I said, I kind of took your feedback from the last meeting and put this together in a framework that Lori and I can use moving forward. It's not intended to be all-inclusive yet. It's just to kind of start the conversation. And Kate, since you have to leave early, I'm just wondering if you want to make any comments that you have before you have to depart.
I just gotta say, I really appreciate this way of capturing information. I haven't seen that done before, and it's great. It inspired me. I will admit to not having looked at it prior to the meeting, but I think it does seem to capture what we talked about, and I find it useful and look forward to digging into it more.
Awesome, thank you. Other comments or thoughts? I'll just kind of open it for discussion at this point. Don't all jump at once.
I can jump in, John. I was looking for my little hand raising thing and I can't find it. This is Molly. So yeah, it looks great. I think one of my first reactions was that I was wondering, and you can tell me, John and Lori, how this will fit. But if we put in if we want to go to decreasing suicide in Jefferson County, wouldn't that be our primary goal? And then one of our objectives to do that would be to improve adolescent resources. So I was wondering about switching those two, if that was appropriate, and then putting a really strong goal on it, like zero suicide or something like that. And then my other comment was that we didn't have the mental health services on here other than the schools. So just figuring out the roles that the other mental health services in the county play in working toward that goal.
I think that's great feedback. I try, let me just explain the kind of the goal and strategy, what I was trying to do, but actually in a lot of ways what you said makes more sense than what I was trying to do, which was my thought was we could put more things under improve resources for adolescent behavioral health besides the teen suicide, but the teen suicide felt a little limiting to me. But that is actually, when the group met, that was the #1 goal that they looked to improve. So I actually think it probably works better to swap those two. And curious what other folks think.
I might be backtracking a little. I think that mental health resources outside the school are really important as well. But for places like Brennan, if they're not in the school, they just really won't happen, for 90% of our kids. So I'm just throwing that out there. And we do have them in the school, so I'm thankful for that. So that was a backtrack, but.
This is Susan, and my comment about that thought, John, is that even though there's so many things that you can put under improved resources for adolescent behavioral health, many things that are going to have impact on teen suicide are going to encompass all those other things that aren't necessarily seemingly directly related. But it seems to me like there's a lot of things that would fit under that would still be in some way affecting ultimately teen suicide.
Great. I think something for us to think about in the more long haul is, the suicide is really focused on adolescent and teens. And I do think, and Jean, I'd be interested in your thoughts about this. I do think there's a need for behavioral health services for kids under the age of 12 or 12 and under. So I want to make sure that whatever we do, we kind of keep that opportunity to look at what services are available for younger kids in the plan.
So I was going to ask about that because I wasn't sure if it was focused on teens for a reason, and if it is, that's wonderful, because that's important. And I always see, that when we're working with younger kids, there's a preventative element to what we're doing, so we can say that it also applies to teenagers. But one statistic that I have found really concerning and interesting recently, and this is a national statistic, but that parents or caregivers taking children ages 5 to 11 to the emergency room for mental health issues has gone up by 25% since the pandemic. I don't know how that plays out locally for us, but those are young kids that are being taken in a mental health kind of crisis. So whether or not we explicitly talk about reducing suicide for all children in Jefferson County, or we just understand that the preventative piece for the younger kids is a part of it, I think it's important that it's in there in some way. So, but I also agree that a lot of things could fall under this plan to reduce teen suicide. Even those preventative pieces could go under that if that's what we agree on. So.
This is Cynthia. Sorry, I turned my camera off because I'm eating soup and I don't want to make you witness that. But I'm wondering if, goals should be outcomes and tactics go under another column, like improving resources or, prevention among younger age groups.
Yeah, I think this framework has really proven to be pretty effective. And I think having 4 levels, you can kind of sort that out in whatever way you want, that you want to be able to do that. So I think, Cynthia, we can probably accommodate, it's really at that activity level is really those tactical things typically is where we put those. But we definitely can do that. Getting back to the idea of kind of, measurable and time-oriented goals, and looking at suicide, how personally I believe the goal should be that we have zero adolescent suicide in Jefferson County. And I don't think anybody would disagree with that goal. So is it okay if we say the high level goal is the suicide rate for Jefferson County will be 0? Or, I can probably word that better, but do people agree that that's the goal that we should be going after?
John, I agree. It seems like we've jumped from a pretty broad goal to a pretty specific objective, and I'm not sure that that's, and then also jumping from objective 1 to strategy 1A, I'm not sure that we have actually taken the opportunity to actually in that strategy understand more about how to reduce teen suicide in Jefferson County. I think we're jumping to some conclusions there about integrating enrichment youth activities, and I'm not sure why it's just for working families. So I feel like we've made some jumps that might not be helpful along the way.
Jenny, can you think of a way to reword that strategy 1A that might be more inclusive and accurate?
I think I'd first go back to the goal.
Okay.
I like the change of the goal, which it looks like we're looking for more specificity in the goal. But then the strategy is, I think that we all have some notion, and post-suicide experience at Blue Heron, we sat and talked about what actually it is that we're learning more about that's leading to a higher level of teen suicide. I'm not sure we've actually done that work fully in order for us to decide then what the activities or the next strategic move should be based on what we know.
What do you think the literature would say about that? Or are there conclusions, that are available to us that we could plug into this model?
There are, and there are a lot of, there's obviously been a lot of work done around that, but we may want to take that work and say, well, that's true in a global sense. What do we know specifically about Jefferson County? I'm just not sure we've done that work. We got kind of started on it after the suicide at Blue Heron, but it fell off because we got really involved in trying to make COVID restrictions work for us. So I want to step back a bit before we integrate enrichment youth activities. We haven't discovered what those are or whether that's even what we need to do.
Well, John, may I add something? This is Denise.
Sure.
In the Healthy Youth Survey statistics for Jefferson County, we see that I'm trying to find that number right now, but there's a high number of youth who report that they have a trusted adult to talk to. It's at like nearly 70%. And then there's also that really high number of youth who say they have suffered hopelessness for every day for 2 weeks or more. And I'm putting all these numbers together for a communications development plan that we're making for both the Port Townsend and the Chimacum coalitions. But so to Jenny's point, I'm not sure what we mean by enrichment activities, but what we're seeing in the Healthy Youth Survey is that even though kids report in high numbers that they have an adult to talk to, that still isn't affecting their sense of hopelessness. And so I think that's worth at least thinking about, because that's saying something to us, right? So I just wanted to highlight that.
Thanks, Denise.
Jenny, from what you learned after the suicide at Blue Heron, what next steps do you recommend the community take to learn what we need to know to do better, and who would need to be in the room for that?
Well, ESD, the Educational Service District, who did come and work with us to start with, has some really wonderful work that's already been done to look at around teen suicide. Also, there's a great book about prevention and postvention around suicide. I just am not sure we've done a good fulsome look to say, oh, now we know, based on what we've learned about teen suicide, both locally and globally, what do we need to think about we want to do to be in the prevention mode, not in the postvention mode. So I just think that's, I think we're missing that step. It's not that there isn't enough stuff out there about it. I'm just not sure in terms of actually sitting down and developing a plan that's consistent with the needs of Jefferson County. I'm not sure that's really been done. Again, ESD 114 can offer some great resources on that.
I mean, Jenny, I totally agree that we should, make sure that whatever strategies and activities we're implementing have evidence base behind them. Do you or anyone else, do you have thoughts about how we scan through all the information that's out there and decide from a Jefferson County point of view, what might be effective and what we should really focus our energies on. I mean, I think that's essentially the work of this group.
That's where I would look to ESD for the leadership in direct guiding the process for our understanding. I don't feel like I have the capacity to do that. They've worked on this for a long time in terms of working with kids. And I think we might look to them as a resource, and they may even be willing to lead us in some kind of learning process around it.
Would you be willing to be the point of contact to reach out to them and see if they'd be willing
Sure.
to attend this meeting and provide us some information?
I will ask them to even send some along before the next meeting so that we have some sense of what they would be willing to offer. There are other organizations, but I just know that they've done a lot of work.
Can I just see a little bit of show of hands that there's agreement that this is kind of a good path for us to go down? Are people feeling like, you know, Jenny's suggestion is kind of on the right track? Yes, no, maybe. I think I'm seeing several hands pop up there. So that'd be great, Jenny, if you're willing to kind of troubleshoot that and provide us the connection. That would be great.
I just would hate to see us go down a road about enrichment youth activities with schools when we may not be on the right road. And I'm not, and the line about that are effective for working families, I'm not sure why working families would be separate from families in general.
Yeah, I mean, that was just you know, from my notes, a comment that someone had made at the last meeting. So I thought it was important to, you know, get that in the plan for us at least to discuss. So
I think that came up in the context of, you know, being isolated during COVID was putting a lot of stress on kids, and sort of a short-term thing that could be done to, you know, kind of improve their quality of life. But I don't think it was, I forget who brought it up, but I don't think it was intended as a, you know, kind of long-term suicide prevention strategy.
I'm newer to the conversation. I've read through all the notes, which were incredibly helpful. And I just kind of want to point out that coming in and seeing this, I'm seeing two things where there's the question of suicide in Jefferson County, regardless of the pandemic, because suicide was an issue prior to the pandemic. And there's also the question then, I mean, I'm wondering about two different questions. One, just suicide in general, and then the other of softening the effect of the pandemic on our youth, because we realize how isolating it's been. So to me, I can see those enrichment activities, like clearly what I see in the kids that we work with at Jumping Mouse is that they are not getting enough contact with other children or adults outside of their families. That's just very clear to me. And that will affect people's mental health, no question. And then there's this bigger question to me of just suicide in general and then Jefferson County. And I think in one of the notes I read, Jenny, you mentioned like we're also talking about a family issue, you know, and those strategies I think need to be a lot more focused, because I agree that it's not just an individual kid issue, that there are these more systems issues for these children that are really impacting them, but not in every situation. So anyway, I just wanted to say, I think I'm noticing there's the lessening the effect of the pandemic, and then there's addressing suicide. And those are two things that feel a little joined, at least when I look at the strategies. Yeah.
Thanks,
and I guess I want to be conscious about what specific things we're doing. And I also, in the kids that we're working with, and as the weather's getting better, I'm wondering what opportunities we have as a community to get kids more connected with each other and with families.
Yeah, I think we're all really sensitive to the strain that this pandemic has put on, particularly on the youth in our community. Can we take a minute and look at the second strategy, strategy B, and get your thoughts about that one? And Jenny, agree that we have to kind of look at all of this in the context of what's the, what are the evidence-based potential solutions for these issues. But also I want to make sure that we continue to move towards some potential solutions that we can implement in our community sooner rather than later, because, well, I think that's one of the reasons we're meeting with some sense of urgency, is I think we're all concerned about what's going on in our community right now. Thoughts or comments about strategy 1B? I don't know if that's an overwhelming approval or an overwhelming disapproval, but I mean, to me, that's kind of the crux of providing more behavioral health services for teens in our community, figuring out how to provide more access. And I don't know what others feel, but that felt like a pretty important activity for us to try to figure out.
John, it might be that I just don't understand it very well, but does it mean that we need to outline what's currently happening to connect kids to mental health services in the school, and then figure out a way to augment that? Is that what that's saying?
I mean, typically that's what you do, is do kind of a survey of what the current resources are in a community, and then do some kind of a gap analysis between, what the current state is and what the future state might look like, and then determine what you can do to start to fill those gaps in the community. So that going through some kind of a process like that would be, I think, what would be intended by something like that. And sometimes just doing the survey is incredibly helpful, because often there are services out there that people don't know about. And when you do the survey and communicate out all the services that are available, often that improves the situation just when people understand all the services that are available. Yeah, that's kind of an overview of, I think, how that would work.
So are you talking about in addition to the schools then?
I would think that it would be in addition to the schools. I think it would be looking broadly at the, what are the services that are available for behavioral health for for all kids. I think if we're going to do it, we might as well look at, I wouldn't want to exclude Jumping Mouse because we put the word adolescent in the, in the goal. So
I guess then I'm kind of thinking about this from the same way that we did the immunization work, is that immunizations occur and improvement in immunizations occur in many different places in our community. And so what we did is divided up people's expertise on the committee. So the people in the schools, the people in healthcare, people in public health, and figured out what was working in each of those locations and what needed, where the gaps were. So I wonder if we could break this down in a similar way. I feel like I can't weigh in on what the schools are doing or need to do, but I certainly can give feedback on what's happening at Jefferson Healthcare and what we could do, where the gaps are and what could be better. So I wonder if we could just break down the strategies into the categories that make sense, and then bring back to the table our own information.
I mean, I think after there's consensus among the group that this is a strategy that's worthwhile and is important for us to do, I think that's an excellent, mechanism of attack for that. I guess I want to make sure that people feel confident that this is work that's, we don't have unlimited resources, so it's making sure that the work that we do is going to be the most beneficial for our, for our community. We get the most bang for our buck. So I'm curious how others feel about, this strategy and kind of what Molly and I have been talking about in terms of, a potential way to implement that strategy.
I think what you're saying sounds good. The strategy seems to imply that the schools are the right nexus for making the connections, and that could be true, but I don't know that we've talked about that, and maybe the, you know, people within the school should.
Yeah, is it important? Did you get another call or something else happen?
Hey, Trish, I think you need to mute yourself if you could.
Sorry, I had to take a call.
That's okay.
I think to your point that adding in general, I think the strategy is a worthy one for us to attack. But if we just added connect more services to mental health services in the schools and in the communities, that might get us to where we want to go.
Yeah, I think that's a lot better too, Jenny.
Now that for me, sitting from where I sit in the school right now at Salish Coast, I think my vision for that does get articulated in the teaming document. But what I would want to see us do is a much better integration and cross connection in the mental health community between the schools, the communities, and the families.
Yeah, and actually strategy 1C is really around that piece of it. That's about connecting providers of behavioral health. Lori, do you mind scrolling down to that for just
sorry, I missed that.
A minute? So that one is really focused on the integration of behavioral health services.
I guess I got a little caught up in the word forum.
Yeah, if you got a better word, like I said, I just kind of threw word salad out on the table for people to comment on.
I think I would say
platform,
provide it or a process for better integration of youth behavioral health services. Because we don't, but back to my, you're going to get tired of me beating the drum about teaming, but I think right now we don't really have much of a process to do just that, to integrate youth behavioral health services across the community.
Yeah, and I'm hoping that this group can at least be a takeoff, plan for that, because I think a lot of the key players of adolescent behavioral health are members of this group, and whether it continues on as this group or, morphs into something a little different. I think it's important.
My door's being knocked on, excuse me.
I think it's important for providers of behavioral health in this community to continue to meet and work on integrating the services that are provided. I think it's vitally important to do that.
John, I think I see it in two ways. One is meeting to integrate the processes and systems, but also a way to integrate our individual care. So if I see a patient at Jefferson Healthcare who Jenny's also seeing at Salish Coast, that those links are facilitated, or with Jumping Mouse or Discovery Behavioral Health, so that communication can happen as well. So I think it's two separate things.
Yeah, and I just so you know, Lori and I are doing some work right now. There are HIPAA concerns and 42 CFR phase 2 concerns about that type of information sharing. So we're doing some work right now to try to figure out what we can and can't do in a group like this in terms of sharing, information on a youth in our community. And I know that's a particularly challenging issue, but I would totally agree that some type of case conferencing or case management, particularly for complicated youth in our community, would be a huge improvement in the care that we deliver. So we'll continue to do that research and hopefully be able to report back to this group about what the potential opportunities and restrictions are on that.
John, this is Tanya. I know that Wendy, Bart, and we recently had a conversation with you and Lori. We haven't found out more about this software called Unite Us, but I'm going to go ahead and put a link in the chat box, because this is precisely the sort of thing that Unite Us is attempting to do. And I think Wendy was trying to do Wendy being the CEO of the Y, she was going to do some research to see how far we've gotten as a state in terms of actually being able to use this software. So it's the software, I don't know if anybody is currently familiar with it, but it's called Unite Us, and I'll put that in the chat box.
It seems,
yeah, go ahead.
to follow on to Tanya's comment, I think it's tomorrow, maybe late tomorrow, that Wendy and I were going to check back, because apparently there's a conversation happening at a maybe state level where some of this may be announced or at least indicated whether it's going forward or not. So we'll certainly know more by our next meeting.
Yeah, and it's helpful to know that this is out there currently. Just, whether or not we wind up using it as a county, I found it really helpful just in terms of getting my own head around that activity of 1C2 of a method of communicating among one another. It was nice to see that somebody had already broken that ground. So. Oh, cool. So Molly's saying, okay. So you have used this, Molly? Or no?
Oh, sorry. I think it's a couple of different conversations going on.
Yeah, there are. Sorry, Tanya.
Regarding the platform, so the OCH has been looking into a platform for bidirectional referrals as well for our 3-county area. So I'm guessing Wendy is working on that, and the state also has a plan like you referred to. So of course, the goal from Jefferson's standpoint is that it integrate with our Epic, but I'm sure you guys are all looking at that. And then my other question was the youth provider meeting through OLICAP. I believe that does case conferencing, and Denise weighed in on that. So.
Yes, and we have done case conferencing at those meetings on a very limited sort of level, because we don't want to be outside of HIPAA rules. So, but yes, we have done some case conferencing.
Denise, are the schools involved in the conversations around case conferencing?
Well, the schools, and I guess, this might take us down some silly rabbit hole, but that's been one of my, sort of concerns all along in the work that I've been doing in Jefferson County for drug and alcohol prevention, is that lots of times there'll be many different meetings that are discussing behavioral health, which I believe prevention to be a part of, drug and alcohol prevention to be a part of, and all the players aren't there. All the right players aren't there. So here we are at this meeting talking about opportunities for youth, but the people from Parks and Rec aren't here. But at any rate, the schools have not been at those meetings, Jenny. It's mostly been OLICAP, youth services, Discovery of Behavioral Health, Cassidy from the state. She does Job Corps type things, and prevention and foster supports.
I think part of the confusion for me is, Tanya and I have worked on a couple of cases of just really blow up big, mental health issues. When I reach out and say, I don't know where to go, because it was Tanya's new navigator role, but now I think there are several navigators, and I don't know which navigator I'm supposed to call. There's more than one committee like this, so I think it'd be important for us to kind of streamline. I think I want to help our kids and advocate for them, and I think other school leaders do, but it's just the road is kind of messy, in my opinion, and in my experience. And our
And
parents, when they have the really big blow up problems, I mean, they're just reaching out, mine are just reaching out any way they know. They're at the ER, they're calling the police, they're calling me, I'm calling Tanya. I mean, you know, there isn't a clear path for those absolutely critical, I mean, suicidal situations. You know, they go to the ER sends them home. And I think, you know, I know I'm just kind of rambling, but those are my challenges.
And I do think doing some kind of a survey of what services are in our community, and then also putting together a group that looks more holistically at collaboration between these agents. I do think that's, Trish, is a potential solution for some of your issues. You know, if we could get a clearer pathway for people, you know, particularly parents of a child that's potentially suicidal. I mean, I think they need to know where to go and how to get the help that they need. And, you know, I heard a nightmare story from a local therapist who took a call from someone who was in that situation. He was the 7th therapist that they had called. And, you know, and he didn't have a slot, but he spent some time making some calls to try to connect the family with somebody that could see them. But we just have to do better than that. We have to do better than that. So I think that's important.
Well, and John, just to kind of underscore the holistic approach conversation, some of you have heard this story, but I'm working with a family of 5 children and a mom living with grandma and grandpa because mom has fled domestic violence in Auburn, Washington, came here in September. We still can't find housing for this family. And now the septic system has failed at grandma and grandpa's house. They do not have $25,000, which is the latest bid, to repair the septic system. And I can tell you it is affecting the mental health of these children. What do we do?
And I bet that's all too common of a story, you know,
Exactly.
of a story in our community.
Yeah. So the mental health is only an outward and visible sign of a bunch of other stuff that I'm not sure we as a community have really built the kind of resources, or even sometimes know. I mean, just trying to find $25,000 for a septic system. So, you know, it's part, mental health is only the tip of the iceberg. Everything underneath it is, I think, more to the point of what we need to be focusing as we can on.
I would like to kind of steer us towards some potential actions and activities coming out of this meeting, if that's okay with everybody. Before I do that, I guess I'd like to kind of summarize what I've heard on this strategic framework, which is probably shift the zero suicide to the goal level. Probably take out the first strategy until we can spend a little bit more time researching and refining that. And then the strategy B and C both seem to resonate with people. And so I will probably spend some time between this time and the next meeting, kind of fleshing those out a little bit more the way that I did with this. And maybe starting to hit down to the activity level with some more specific activities. And I just get a kind of a thumbs up, thumbs down. And if it's thumbs down, give me more information about what you think I should do. I think I'm mainly seeing thumbs up. Okay, and then, so what I'd like to, we'll talk a little bit more about the next meeting, but what I'd like to do in the next meeting is to see if there are any of those, you know, anything underneath those strategies that we might be able to start implementing soon. Because I think, at least for me, I got the sense that there's some urgency in our community to make some progress on these issues. And Jenny, while I totally agree that we should make sure that what we're doing, you know, is evidence-based and is going to really make a difference, I also feel like we have to balance that with, you know, making sure that we're not sitting here talking so long that there's another suicide in our community. So, so if you guys agree, the next time we meet, we'll be spending some time trying to, under those two strategies that we just talked about, see if we can develop some activities that we can actually start to implement. And I personally feel like that's the right thing to do. I hope you guys do as well.
John, I agree, but also wonder if it might, I really don't have a good sense of the map of resources already available in our county. And I do feel like you guys all have a sense of at least your own worlds. So I'm wondering if we could each bring back to the next meeting the resources available in our own organization or structurally, so that we aren't solving a problem that isn't there, and we are solving problems that are there. So what's really helpful for me is having just a picture or a map of it, but so I just need to get that into my head. How does DBH fit in? How does the community fit in? How do the schools fit in? How does Jefferson healthcare fit in? How does, et cetera? How do the police? So that we know how to start making those connections and do something about that. Would that be okay?
Yeah, I totally agree with that, Molly. I actually just wanted to get approval that strategy, that people agreed with that, but it sounds like people do. And maybe the focus of next meeting can be kind of the initial steps of resource mapping in the community. So a little bit of homework for everybody, if you could each go back. If anybody has a template, I'll do some research and see if I can find a template for people to kind of write out what their services are and how their processes work. But in the meantime, I think it's great for you to start doing that work. And I think it's definitely important. I just don't want to forge out too far ahead, but that doesn't feel too far ahead to me. People kind of agree that that's good. Okay. Lexa?
I just had one quick thought. In thinking through the different strategies, I'm reflecting that some feel very upstream, as in more sort of early preventative, and others feel very downstream, as in what do we do when there's a child in the ER right now and there's no beds. So a lot of suicide prevention work sort of exists on this spectrum, and making sure that we're hitting upstream, midstream, and downstream. So as we're sort of grappling with the different strategies, I wonder if it's helpful to think within that frame of like, what's a upstream thing that we can do? What is midstream? What is downstream? And organize it in that way. Just something to think about before the next meeting.
I would also like to offer, I think that's an excellent idea, Alexa. I'd like to offer, if folks wanted to send resources, we can start to combine it into a master document that we're looking at together at our next meeting, as opposed to going from a bunch of different formats. And it sounds like the two things we're looking for is, what is the resource? What does it do? Is there a third aspect to it that we should add to that column, to that sheet? Okay, so send me any of those resources with the second column, and we'll get them into a master document that we can look at next.
Maybe it should also include, how to access it, like whether it needs a referral or.
Yeah. I was about to say that too, Cynthia. So I totally agree with that. That's great.
Thanks, Cynthia. Excellent. In fact, I could set up a template that I send out to folks that you could just throw your stuff into, if that was easy.
Let's do that, Lori.
Okay. And if you don't
Might even be helpful. Sorry. Oh, to have a column that where people can indicate if they know, like Lexa was saying, if it's upstream, downstream, midstream, to indicate that in one of the columns, just as sort of a shorthand, because I find that framework to be really helpful.
Excellent. We'll create a framework and put it up on the website so you guys can download it.
And email it out to you guys.
And
I know not everybody goes to our website, though you should, because it's really awesome.
Well, one of the reasons for doing that is we've been encouraged on this side not to attach so many documents because of how much space it's taking up out there. So we're trying to host it in one place.
So
I don't know if this would be helpful for other people, but I wonder if it'd be helpful to add a column of what we don't do. Because I'm thinking about, for instance, Jumping Mouse, I can tell you what we do, but for instance, we don't do full wraparound care for families. And when we get referred certain families that are in a certain level of crisis, we're like, wow, I'm not sure we can serve the family the way they are going to need it. So it might be helpful for people also to know what we do not do as an agency. And then we might also be able to identify where some of those gaps are. If we're like, wow, all of these places are not able to do this piece.
Mhm.
yeah, I think that's a great suggestion, Jean. So the slide we skipped over so that Kate could have an opportunity to comment on the strategic framework was about the data from the last meeting. And I basically just wanted to check with you guys to see if you had any questions. You know, we went over a lot of data, kind of fire hosed you at the last meeting, and did you go home and say, oh, I don't really understand that, or I still have a question about that, or any thoughts from the slides from last meeting or questions? Lori, you're being masterful at switching back and forth. Thank you. Really good job.
Or making you nauseous, one or the other.
Folks were good about that. Okay, so the next thing is to just make sure, my thought right now, I need a little time between meetings to put information together. So I'm thinking if we meet on a 3-week cycle, I know that's a little more difficult for people's schedules, but I'm hoping that that works for you guys. I think Lori has the next 4 meetings blocked out, dates. And does this time still work for folks, the 12:15 to 1:15? Just kind of want to get some verification that, yes, this works and meeting on this sequence seems good to you guys. Frequency.
If I were to do this sequencing of every 3 weeks through August, will that work for folks? And then it's all in your calendars and it's one fell swoop. And you've probably already figured this out, but as we'll send out the calendar invite, and then for each meeting, we will add links to the materials for that meeting or notes from the last meeting, that sort of thing. So if you see it again, it's not that you have to accept it again. It's just probably got some new information. And I try to note that with a line at the very top that says what's being updated to that invitation.
Generally, seems like a good frequency to meet, and this time still working for folks. All right. Okay, I think those are kind of that's where we wanted to be able to get at the end of today. We have 5 more minutes. Any other thoughts or comments before we adjourn?
Is there anyone missing from the table that needs to be in this conversation now that we have a deeper understanding of sort of the direction we're going?
Yeah, that's a really good question. Thanks, Jenny.
No. The youth provider group, Denise, I'm not familiar with that, so I don't know if there's somebody from there that should be
Well,
here.
that would be like Samantha Troxler from OLICAP, or, you know, maybe someone from the Chimacum School District, unless Trish is here to represent all 3 of the school districts, or all 4 of the school districts. I'm not exactly sure. But definitely there's, you know, Trish is here from Brennan, but there's nobody here from Quilcene, and there's no one here from Port Townsend, there's no one here from Chimacum. And so if we're actually talking about, I mean, Jenny, obviously you're from Port Townsend. Sorry about that.
That's okay.
But, you know, if we're talking about doing something that's going to involve the school systems districts, that maybe they should be present. The 2 that are missing, Chimacum and Quilcene.
And because of the far reach of the work of OLICAP, I'm wondering if someone from OLICAP would be helpful to be here. And or Dove House as well.
Right, Dove House. You know, maybe not sure if we want to involve Matt Tyler from Parks and Rec right away, but maybe at some point we do want to have Matt come and tell us about all of the offerings that Parks and Rec has. Because I think that if we did an analysis, we might find out that there actually are lots of opportunities for kids to do things here. And then that we'd be running up against the things that keep kids from participating, which could be a variety of things, mild depression, feelings of isolation, and like they're not included, all those sorts of emotional, behavioral, emotional things that are involved in getting involved in clubs. So, yeah.
So do people agree adding Chimicum and Quilcene? Thumbs up on that. And then Olicap, thumbs up on that.
Is Ciela part of our group?
That would be a great idea, Tanya. Ciela Meyer, she's with the ESD now, and she does regional behavioral health services. So I can give you her email, Lori.
Thank you. Thank you. And if you have specific names from OLCAP or Dove House, I'd welcome those as well.
I mean, for me, it's always a balance of, when the group gets too big, it gets kind of difficult to do things, but also you want to be inclusive. So it's kind of that challenge. Like when you were talking about Matt, it seems like it's probably more reasonable to have him come to a meeting or two while we're talking about that, but then not be a permanent member. Okay, that seems reasonable. All right. All right, well, we're just about at time. I can't say enough. Thank you all for participating in this. I know you're all have really busy lives and there's a lot going on, but honestly, for me personally, I can't imagine anything more important than taking care of the kids in our community. So I'm really glad that this group is meeting and doing this work. And, I hope we can do things that really actually make a difference for the kids in our community. And Jean, I think you should have your daughter wave us goodbye. Oh, nope. All right.
Suddenly shy.
All right. Well, thanks everyone. And I'll see you in 3 weeks if I don't run into you before. Thanks a lot. Bye-bye.
Bye.